Well, if you think that my introduction was a little frenetic, going back and forth between different points of view, that's because it really has developed that way. I was very strongly against the idea that breast implant illness was a real thing, and now I'm not so sure. And so I have brought two people who have expertise from different perspectives, and I've brought them on the show, and they've been kind enough to join me to share their input on their views on breast implant illness, what it is, how it affects women, and really how we should move forward with this. I have with me today Dr. Christine Stiles. Dr. Stiles is an assistant professor at the Department of Plastic Surgery at the University of Texas Southwestern Medical Center. She specializes currently in adult plastic surgery, and she's joined the Department of Plastic Surgery at UT Southwestern in 2020 after being in practice for about 18 years before that. In addition to her association with the University of Texas at Southwestern, she's a member of several plastic surgery and professional organizations, including the American Society of Plastic the American. John, let's start that or stop that and let me kind of start again. Okay. She's a member of several professional organizations, including the American Society for Aesthetic Plastic Surgery, the Texas Society of Plastic Surgeons, the Texas Medical Association, and the Dallas Society of Plastic Surgeons. She's also a member of the Academy of Pediatrics and certified by the American Board of Plastic Surgery. Dr. Stiles, thank you so much for being with us.
Thank you for having me.
We also have Darnah Mercieca. Darnah is a vocal advocate for breast explant awareness and the recognition of breast implant illness. After her personal struggle with breast implant illness, Darnah transformed her experiences into empowerment. She hosts the Empowerment Explant podcast and maintains an active YouTube channel. Darnah dedicates her time to raising awareness about the consequences of breast implant illness and supporting women on their journey to explantation and healing. She is also a certified integrative nutrition health coach and a certified personal trainer and listed with the United States Registry of Exercise Professional. Darnah, thank you so much for joining us today.
Thank you for having me, Dr. Grossman.
I want to get into this whole topic of breast implant illness first by asking both of you. Maybe I'll start with you, Darnah. You obviously are very candid about your having history of breast implant illness, which of course means that you at one point had breast implants. Tell me why you went there. Why do you feel having breast implants was popular, so much so that it made you decide to go in that direction?
That is a good question. So I was 23 when I got them done, and I was fresh off the boat from Australia, living in Hollywood, California. And interestingly enough, I was actually pretty confident in my body when I first got to the States. And then after being in a relationship that was not very stable and being cheated on and going through that whole process with my husband, I started questioning myself and my enoughness and looking in the mirror and looking around me and just being in that state of comparison and wondering, am I enough? Maybe if I looked like her, then he wouldn't have done that. Maybe he will come back to me. Maybe I will be enough. Maybe I will be desirable to other men. All of these things going through my head. And so it was a pretty straightforward decision for me at that age. I met a porn star in a nightclub, actually. She had great boobs. And I said to her, "Where did you get those?" And she told me the name of her surgeon, and I went in for a consultation. And, I don't really know exactly how long after my consult it was that I was under the knife, but I know that it wasn't very long after. And then I had, I went from a B to a a double D, which I wasn't expecting the double D. I was going for a small D, but you don't always get what you sign up for. And there you have it. I had these implants. And I'm not going to say that I didn't have a great time with them at first. I absolutely did. We had a lot of fun around Hollywood and beyond. But that then later on came with implications for me.
Dr. Stiles, breast implant surgery is among the most popular even today, even with all of these things that are circulating about the negatives of breast implant surgery. Why do you think that breast implant surgery remains as popular as it is? And is it something that you perform right now?
Oh, sure. I think Darnah's story is very common for a lot of women because I think a lot of women seek plastic surgery when there's a turning point in their lives, and those can be good turning points or bad turning points. When you look at women's fashion, when you look at magazines, when you look on the internet, so much of that female identity actually comes from their figures, their breasts, and it's a constant, it's a constant reminder. And if you're someone who is insecure in your body, or, you don't feel that you match up, you have these options out there that can help fix that. And so, plastic surgery is great in so many ways, but there are certain things that it can't do. And so I think it's it's always in the top one or two procedures with the Aesthetic Society year after year. And I think it's because that impression is always, it's out there. And then, it also is a procedure that helps women get their breasts back after having babies and breastfeeding and all of the changes that women go through with those events, or our massive weight loss population where they lose their breast volume and basically they have the skin and they have nothing to fill it. And so breast implants have been that procedure and that that thing that can help fill a void or fill back that space. And so that's why I think there are a lot of societal reasons why it's one of the most popular procedures. And Darnah also tipped on something. Women are always comparing themselves to other women, and so you look at what somebody else has, or how they look in that swimsuit or how they look in that dress, and a lot of times it's because of how they fill out the breast area of the outfit that makes it more attractive.
So there are a number of reasons, and I think both of you agree as to many of the reasons as to why people are so focused on breast implants. And I think we live in a mammary-centric world. Fashion is focused around the breast, and so much in media and entertainment and videos have to deal with it. So there's a lot of peer pressure that comes about on women and men, but I think women, the marketing tends to focus a lot more on women. And so whether it's shape of the buttocks or shape of the breast, there's lots of pressure on that. So I think that that's something that we have to recognize may push people in a direction that otherwise they may have taken a little bit more time to consider. But I do feel that it's a procedure that's been around a long time. The both of you are in Texas, and it's a procedure that basically started in the state of Texas back in the 60s, and has, like everything in Texas, has gotten pretty big over the years. Let's talk about breast implant illness for a second. And right now, Dr. Stiles, who's defining breast implant illness right now? Is it being defined by the medical community, or is it being more defined by social media or focus groups, or a combination of both?
So that's a very good question, because I think that we are at a point where, from a society standpoint and the plastic surgery world, we're trying to figure out how it fits into what we know scientifically and what we hear from our patients. Because, the societies have put a lot of money into studies to look at what could be related to the implant causing problems that we see in our patients on a regular basis. And, part of the problem with breast implant illness is there are about 100 symptoms that have been reported. A lot of them are vague. A lot of them relate to other things that women go through throughout life, whether that's menopause, hypothyroidism, just autoimmune disease, and trying to find out if there truly is a correlation between the breast implants themselves and these symptoms is a challenge that I think, the society is really taking on and investigating. I think a lot of the drive that's bringing women into our practices comes from social media, because that's what they see and hear, and and there's a lot of information out there through social media, and I think it's our responsibility to go over the symptoms and see what, if anything, we can do that would help.
Darnah, you become one of the most recognized advocates for breast implant illness. Even what you have on the back of your wall will kind of give people an indication of your advocacy.
Yes.
Tell us your definition. And when I say yours, I mean you and focus groups that you work with, the definition of what breast implant illness is. Maybe perhaps start with your own, and then tell us, from the people that you speak to, what their association is with their breast implants.
Yeah, yes, I would love to start with my definition, because I think that it's important to define it in a way that is easy for women to understand, right? Because it can help them understand how they can heal going forward. So breast implant illness is like an umbrella term for a long list of systemic symptoms that occur at some point after getting breast implants, and it could be right away or it could be years down the line. But these systemic symptoms are caused by inflammatory, toxicity, or bacterial responses in the body, right? So, if you Google search, the way I kind of like to look at it is, if you Google search symptoms of chronic inflammation or silicone toxicity, or even foreign body response, then you will see a long list of symptoms that align with breast implant illness, right? And this is where it just makes sense to me, and it clicked. I'm like, oh, duh. And of course, those conditions can then trigger other issues, such as autoimmune disease, for example, hormone disruption, chronic illness. So a long list. And they then also end up falling under the BII umbrella if the implants are that known or suspected cause. Is that helpful?
Yeah.
Cool.
So specifically, so our audience is kind of saying, okay, when you're saying breast implant illness, okay, give me an example of what it is, so that the audience is like saying, oh yeah, I see what you're saying.
Okay. So like Dr. Stiles said, there are a long list of those symptoms, right? But essentially, if you are just feeling like you're sick all the time, you are fatigued, your energy is just off, you have joint pain, your hair is starting to fall out, you do have hormone issues, maybe your autoimmune conditions are flaring up more regularly, or you've got new autoimmune conditions that you didn't know that you had. All of these things, it's just important to take a look at those and that's where you start to go down the path of, okay, how do we diagnose breast implant illness, right? How do we know that there's that correlation? And that's where you go down the path of investigation.
Were those your symptoms?
Yes, and so I don't have any diagnosed autoimmune conditions. I had really chronic fatigue, very bad brain fog, tons of neurological issues to where I couldn't even string together a sentence. This conversation would have been near impossible for me. I was losing my hair really badly. I had all these random skin conditions coming up. I had my ears were ringing very badly. There was a long list. I could go on for sure.
And as you said, it can be variable from woman to woman, but in your particular case, from the time you had your implants to the time you began putting together that some of these symptoms I'm having may be related to my implants, when did you start feeling symptomatic of breast implant illness?
Let me count the years. Hang on. How many years in was that? Okay, so I got my implants in 2000. Someone helped me with the math. I got them in 2012, and by 2000, goodness, I would say by 2018, it was very noticeable that I was unwell, right? And there were things that were leading up to that I hadn't really put together. But by 2018, I'm like, oh, okay, I'm not well. I don't know why that is. And I started going on that hunt, because I was actually studying at the time to become a health coach. And that's what triggered, like, oh, let's start diving deeper into what's going on in my body.
Dr. Stiles, is Darnah's story and her particular situation similar to other women that you see who come and have concerns about breast implant illness?
Yeah, I think, those are some of the top problems and symptoms that women come in and they're concerned with. Brain fog, fatigue, and I think rashes are the top 3 symptoms that I tend to see. The true autoimmune diagnoses vary a lot. I don't see those quite as much. And I think it's difficult because we do see women who, they come in, they feel awful, and all these things are going on. And, they start this path of trying to take things out of their lives to figure out what it is, because they want to feel better. And so a lot of times they'll start with, a gluten-free diet, or they'll make smaller changes. And then as it continues, and then now what I've seen is sometimes a primary care physician will say, well, you know what, you should really get your implants looked at, and you maybe even consider having them taken out. And so I think part of the issue that's really confusing is, I know I have patients who had saline implants. They, didn't have any problems at all with the implants themselves, no breast pain, no problems directly related to the breast. But they have the fatigue, they have rashes, they have these other kind of vague problems, and they get to a point where they just want their implants out. And some of them feel great and they feel better. And when I'm in the OR looking at the device, there's nothing wrong with the device. The capsules for most of these patients are very, very thin. And, some of them feel great after they have them out, but there's a lot of women who don't feel any better after having their implants out. And so it's difficult because we can't tell them, you know what, we're going to go in, we're going to take the implant out, and you are going to feel great. I approach it more as, we can take the implants out, we'll take out the capsules, and we'll give it 6 months and see how you feel. And, you know, I mean, now I'm at a point where I have patients coming back years after having their implants out. They don't feel any better and they want implants back in. So, because they start to deal with, you know, the psychological problems that they had that led them to get the implants in the first place. And now their breasts are stretched out, or they're just older and they don't have, you know, they don't look like a nice A or B cup anymore. And so they're uncomfortable in how they look, in clothes, out of clothes. And, you know, it really didn't make much of a difference in how they felt. Go ahead.
Have you had the experience of some woman coming to you and saying, I want my implants out, I believe they're causing me these systemic effects? You take them out and transiently they're better, but then the effects come back.
Well, so I think, yes, I definitely have seen that. I think a big part of what happens initially is a lot of patients will develop so much stress about having this device in their body that they think is making them sick. And the stress and anxiety compounds whatever problems they're having. Because we know, I mean, stress leads to your hair falling out. Stress leads to problems with your skins. And so that component, I think, helps initially and then doesn't continue on, you know, for years later. I think and Dr. Grossman, you'll probably think about this too, but it's interesting to me to see these patients who are now in their 70s who had the Dow Corning implants that are leaking, they're hard, they're encapsulated, and they have these rock hard capsules. They don't have any problems. They, you know, even at 70, they want new implants in. They don't have the fatigue, brain fog, and all of these other problems. And, you know, I sit back and look at what we find on the table, and I can't correlate it to what we're seeing clinically from the patient's problems.
So is there a way to confirm a diagnosis of breast implant illness right now?
Are you asking me?
Yes, I am.
I think it's really, at this point, it's a diagnosis of exclusion and trial and error, because if you take out the implants and patients feel better, you look back and you say, okay, this must be breast implant illness. I don't know of any testing or any specific thing that you can do to diagnose it ahead of time. It's more clinical symptoms and then what happens after the implants come out.
Darnah, do you agree with that? And if so, do you think that's part of the reason why women have difficulty, is almost an invalidation of their symptoms, because there are some people in the medical profession who say, if I can't prove it, it doesn't exist?
Yeah, that is definitely a thing. So first of all, going back to the diagnosis part, kind of like where I defined breast implant illness, I like to explain that BII isn't the condition. It's the possible root cause or contributor. And whenever you're trying to find a root cause, it takes investigation, right? And that's where, you know, my health coaching comes in, and that's where I love the functional medicine side of things over conventional medicine, because in conventional medicine, you look at the body very separately. This part, that part, go see a specialist for this, go see a specialist for that. Whereas in functional medicine, you look at the body as a whole, everything's a system, it all works together, and it all affects everything affects everything, right? And so I think that there's a way to inform the likelihood of your breast implants being at the root cause of the issue. And Dr. Stiles, you're right completely in that it is a matter of investigation. It's a matter of, okay, let's look at everything. And, firstly, with the obvious, how long have you had your implants? Is there any breast pain or capsular contracture? Have you had an MRI or ultrasound to check for any rupture or leakage? There's thermography, which is really helpful to locate sources of inflammation. And that really can show a lot. There's blood tests for inflammatory markers or heavy metal toxicity, which, yes, inflammation and heavy metal toxicity can be coming from other areas. So then you also have to check, your environment, what else is going on in your lifestyle. DNA testing to see if you're more at risk of breast implants causing issues. And then there's obviously looking at health history, like your patient's history or family history of autoimmune conditions, and what other lifestyle factors could be causing any of this. What does your diet look like? What does your environment look like? And, to be honest, I just think that you can get to that place where it's like, okay. And it was like that with me and a lot of women that I see going through this. You get to a point where you've checked all these boxes, you've looked at so many different things. And I was like, okay, well, it has to be related because there's no real other reason in my lifestyle why I should have this level of inflammation in my body or why these symptoms should exist. And then it comes down to making that decision of, okay, I'm going to take that leap of faith, I suppose you could say. But I like to say you're making that decision. And this is how there's that fear of, oh my gosh, what if my symptoms don't get better after I take them out? And my answer to that is, ultimately, you are doing your body a favor in some regard by taking away a source of inflammation, a source of foreign material that your body is fighting in some way. And so your body is going to be able to better heal other things that are going on in your body if it is something else.
So can I comment on one thing you said? Because I fully agree. If you have a leaking silicone implant, or you have a ruptured implant, and your body has developed a bad capsular contracture and it's laying down scar tissue to contain that implant, that becomes a source of inflammation. And so in my mind, it makes sense that if you have an active source that's triggering inflammation, it can lead to other problems like joint pain and rashes, and it takes away some of your cognitive abilities because your body is focusing on that source of inflammation. Mm-hmm. But the strange thing is when you see somebody who has a perfect result from a breast augmentation, no capsular contracture, nothing that we can see wrong with their breasts or their implants, and they become focused on the breast implants causing these other problems.
You're speaking to her. My breast implants came out perfect. No leakage, no rupture, no signs of that. My capsule was attaching itself under my arms and into my ribs, which was causing me postural issues and different, other pain. But there was no visible signs of device failure, so to speak, with me. But all of my symptoms cleared up within 3 months of removing my breast implants. And it wasn't stress induced or anything along those lines. Because ultimately any foreign body, whether it's a tooth implant or any foreign material in your body, causes an inflammatory response.
I want to get to that in a moment, that what you just said there. But since you both have mentioned capsules and capsular contracture, perhaps for our members of our audience who aren't necessarily familiar with it, Dr. Stiles, could you describe or define what a capsule is and what a capsular contracture is?
Sure. So a capsule is basically scar tissue that forms around the implant. And pretty much any device that physicians and surgeons put into a patient's body will cause a response, whether it's heart valve, a knee, a hip. And when it's around an implant, basically we look at that capsule and grade it on a level of 1 to 4. And 1 is scar tissue that you go in and you find when you take out the implants. It's undetectable and doesn't cause any problems. And then that kind of escalates to a grade 4, where you have physical hardening and pain around the implant. And so obviously grade 4 is much more severe. Sometimes that's just a very thick rubbery capsule. Sometimes it can have calcium in it and feel almost like an eggshell. And the problem, as you mentioned, with a capsular contracture, it will attach to the muscles, it will attach to the soft tissue. Sometimes it can make it difficult to move your arms or stretch your back, and it can lead to a significant amount of pain.
Darnah, you very correctly mentioned that anytime you put a foreign object, you're going to get an inflammatory response. So I'm wondering, in your focus groups that you have and that you educate people on, are you having anybody complain of breast implant illness-like symptoms with other types of implants? Now, granted, breast implants numbers-wise are far greater than most any others, so we may not see those numbers, but buttock implants used to be more popular before fat transfer to that area became more common. Cheek implants, chin implants, or non-cosmetic implants. Have anybody joined your discussions who have other foreign bodies and have the same type of symptoms, or is it simply limited to those women who've had breast implants?
So I'll be honest with you, I don't have broad discussions about other implants. And in my community, no one has come in really talking about any other implants that they may have in their bodies. You can see that my little sign on the wall is all about the chest area. But I've spoken with, as part of my podcast, I've spoken with just several different professionals across the medical field, and a lot of them have spoken to the inflammatory response from other implants, whether that's hip or knee or like wherever it is in the body. I'm not talking about obviously, butt implants or anything aesthetic, but they all cause that similar inflammatory response and can cause the similar symptoms. Because really, like I said, like if you Google the symptoms of inflammation, they really do align.
Mm-hmm. I'm not aware, Dr. Stiles, of the relationship with other implants with the same symptoms that breast implant is, but quite honestly, I haven't looked for it until we're having this discussion right now. So I'm just wondering if you've had, any feedback during your studies that other types of implants can cause the same type of symptoms.
I don't know of any other implants that are looked at quite this way. I think, another thing is if you think about why someone would get a knee replacement or a hip replacement, usually you're going in and you're taking out very inflamed tissue and you're replacing it with a device, which is obviously very different from what happens with a breast implant. I think, and if I could ask Darnah one question too, because it's also interesting to me that breast implant illness is much more a problem in patients who have had implants placed for cosmetic reasons and not for reconstructive reasons. For example, our, breast cancer population doesn't seem to have the same issues and concerns with breast implant illness that the cosmetic patients do. And so I would wonder if in your interest groups you see the reconstructive patients also.
Yeah, that's really interesting that that's been your observation. In my community, I speak to a lot of women who have been reconstructive patients, had cancer, who have had their implants removed because of breast implant illness, or who are suffering with breast implant illness symptoms. So for me, it is common, but I would also say that I think that there would also be some psychological component to that, because if, I'm happy to throw myself under the bus and use myself as an example. So say me, for example, 23 years old, went from, a size B to a size double D because I was feeling, down on myself at the time. And now I've removed them. I go back to a B, a more deflated version than I used to have at 23, trust me. But that's not that psychologically severe, although it is. It's a big shift for anybody. This is a hugely emotional journey. And I don't want to detract from that. But for a woman who's undergone reconstructive surgery, especially, right, if they were going to remove their breast implants, if they were going to be left, flat or with, severe scarring, all those kinds of things, maybe concave, all of those things are a lot more challenging to deal with. And I think that a lot of women would be more willing to push aside the thought of some symptoms to maintain that appearance.
I wonder if how you differentiate from women who say they have breast implant illness when really what they're having is the physical effects of capsular contracture. But they feel bad, and so they're lumped into the brain fog, the fatigue, the hair loss, and everything else. When in fact, perhaps their symptoms are much more limited. Do you have a way of distinguishing that? Because when you were mentioning the fact that you have a lot of people who are patients who have had breast reconstruction, I'm thinking, well, those patients have a much, much higher incidence of capsular contracture than cosmetic breast augmentation. And so their symptoms may be more related to the physicality of the capsular contracture than the systemic aspect of breast implant illness. So tell me, am I wrong there? Or do you have a way of differentiating between simply the signs of capsular contracture that people don't like versus the systemic issues that you brought up earlier?
Well, I think that comes back to, asking the questions, okay, are you feeling the physical effects of the pain, the tightness, the shift, all of that, or are you getting the systemic symptoms of, the brain fog and all of that? So I think that can help bring awareness there. But if you're kind of maybe asking, okay, so if this woman has capsular contracture, why would they not replace the implant? Maybe it wasn't. Maybe it was more so a response to the contracture than the implant itself. So replace the implant, the capsular contracture goes away, and they're set. Well, a lot of these women, it kind of all goes hand in hand. So when they're having these symptoms, it affects them systemically for the most part in some way. And they don't want to have to deal with it again because they want to feel healthy. They just went through breast cancer. And I mean, I know one woman, she went through breast cancer and it was torturous for her, obviously. But the symptoms from her breast implants were worse. And she said, I didn't sign up for that. I didn't sign up for, removing cancer to feel worse. I just want to live my life and feel grateful for having a life to live. And I think that that's where it really comes down to the individual on like, what do they want, especially knowing if they do have a higher risk of capsular contracture, there's a higher risk of it happening again with a replacement.
So this is to both of you. The FDA had said that gel breast implants, this is back when they let them come back in the market back in the early 2000s, were among the most studied medical devices ever. So if that's the case, what did we miss in those 14 years that they were off the market, and then missed the fact that something's still wrong, and now in 2023, this breast implant illness concern is probably as prevalent, maybe not as frightful as it was in the 90s. What do you think we missed, Dr. Stiles? Or did we?
You mean, what do you think we missed in studying the implants?
We talked about investigation, and it seems like there was a prolonged investigation, and the conclusion was there wasn't a cause and effect from implants and autoimmune disease or other diseases specifically linked to breast implants. But something's not right.
You know, I don't really know. You know, the follow-up studies, and I mean, I was involved with the 10-year, you know, follow-up studies of patients who had implants, and I don't remember a patient questionnaire asking, do you have brain fog? Do you have, you know, it wasn't a follow-up study of how do you feel, do you have these symptoms. It was a follow-up study of, you know, success of the implant, deflation, rupture, capsular contracture, who went back to the OR for removal replacement. But, you know, in that time frame, we didn't have a lot of women getting silicone implants. I mean, the other thing too is in, you know, Caroline Glicksman and Pat McGuire's study, they had silicone implants, they had saline implants, and a lot of the women who had breast implant illness symptoms had saline implants. So I don't really know.
Darnah, what do you think plastic surgeons, the FDA, the implant companies missed that back in 2006 they said, okay, you know, go ahead, we're not restricting it at all?
When you said the FDA said that the gel breast implants were the most studied medical device ever, I was like, I didn't see that FDA report. And if that's true, that is scary news for all medical devices. But what was missed, what was missed in those 14 years was probably money, mostly. All I know now is the FDA has acknowledged the existence of breast implant illness, the associated risk of cancer, the chemicals and heavy metals, and the importance about warning patients about the risks and complications. So I don't know what was missed then, but obviously something has really come to light now, and they're looking at more than just the device itself, and they're looking at the human behind the device.
Dr. Stiles, is that your belief too, that the FDA has recognized breast implant illness?
With the patient decision, what do they call? The patient decision checklist that we need to go over with every patient now who's having breast implants placed. it includes addressing the signs that there may be a correlation between these symptoms and having breast implants, and it's something that we make women aware of before they have their augmentations. I think it's important to note that breast implant illness and breast implant associated lymphoma are two very separate things, and they should never be confused because if you're someone who feels like you have breast implant illness, I would hate for you to now worry about having lymphoma, because that is a completely separate disease entity.
Yeah, I think we do need to make that point, and I wanted to stay away from breast implant associated lymphoma, which is a real but very rare issue right now, and not to be confused with what we're calling breast implant illness. But back in the 90s, when implants were taken off the market, and there was a deluge of lawsuits, and the lawsuits went against the manufacturers of implants, the surgeons who put them in. It created a really intense scare among women, and a lot of women who weren't having any symptoms at all were having their implants removed, and then subsequently some left them out, and some subsequently they had them put back in. Are we heading towards another scare that, because of some outliers, will affect hundreds of thousands of individuals who want breast implants?
I would say yes. I mean, I remember in the 90s, I was in New York, and the Connie Chung report, oh, my lighting just went out. But, I was in New York, and the Connie Chung report went out, and I drove a lot of women to get their implants removed for no true valid reason. And I think social media is really good for connecting with people and getting people to talk to one another, but I don't think it's the best place to get your medical advice. And I think that that's a big problem.
So, Darnah, I'm going to lead to kind of the something that we talked a little bit earlier about, and that, obviously I've been following some of the things that you've been posting, and you're very articulate and very, again, candid with your point of view. But in one of your videos, you did state that if you're a woman, all of you should get your breast implants removed. So to me, as a plastic surgeon, I go, well, that seems a little bit on the extreme. So I want to know, were you doing that for effect, or do you believe that? And if in either way, tell me how that came out, and tell me what your beliefs are right now on that.
Thank you. Okay. Well, to be honest, I don't remember saying that, because that doesn't sound aligned with how I approach this whole topic now. I'm not saying I didn't say that, and I truly believe you, because you obviously saw me say it. So if it is in a video that I recorded, it was likely when I was still sick with my implants or shortly after. And so honestly, I would contribute that to probably being very angry, to be honest. And please let me know which video that is in, so I can put a little angry woman disclaimer in there, like, hey.
We'll have I'll have Max or John kind of put that little clip in your empowerment videos, just so we can show, because I do think that, look, we can all say things, and then ultimately we all evolve and change our mind. So that's what I want to hear, where you're at.
Yeah. And so I'll tell you where my head is with that now. And like I said, I was angry. I was in pain. I was upset. And I'm not telling all people to remove them, to run out and book their explant surgery. I'm encouraging all people to understand the implications of having them, the possible effect that they have on your body, whether symptomatic or not, because there's still an effect in your body. And that can be physical, it can be postural. I had a lot of postural issues. So just know what's going on inside your own body, and prepare them for the fact that one day this is very likely a decision that they're going to have to face, either because they're sick, they have a device failure, some kind of complication, or they just feel like they're ready to get back to their natural bodies. And so, going back to implants essentially causing that constant low-grade inflammation, which is at the root cause of all chronic illness and disease. If you have those autoimmune conditions and seem to be unwell a lot and all of those things, it's something that needs to be looked at. So in my approach, it's definitely not everyone must remove their breast implants. It's everyone should understand the effects of implants and the effects that they have on their health and feel empowered and safe, importantly safe, to return back to their natural bodies when they feel ready to do so.
Dr. Stiles, if somebody comes to you and they believe that they have breast implant illness and you've discussed the risks and benefits of doing something about it, what is the treatment of choice right now? And how do you try to treat somebody who either they believe or you believe are consistent with the symptoms of breast implant illness?
So we have a long discussion about what I think we can do. And I would agree with your statement in the beginning where if a patient comes in and they say, I just want my implants out, I'm happy to take them out. And I will, take them out. I try to get all of the capsule out. Oftentimes there's a part of the capsule that is stuck down to the chest wall, and it causes more problems to try to take that out than to just, we cauterize it, we burn the surface off, and we'll get as much of the, get the implant out, sometimes with the capsule intact, and sometimes we have to break the capsule, take the implant out, and then take the capsule out separately. In the studies where they've looked at whether it makes a difference if you take the whole capsule out, part of the capsule out, or none of the capsule out, the symptom relief was the same across all of the groups that had the implants removed. I also think a lot of patients come in and they only want me to take out their implants if I promise that I will do an en bloc resection. And I'll explain to them, I can't guarantee that, because if it is stuck down to the chest wall, we risk giving you a pneumothorax and having more complications.
So let me just interrupt for those people who are listening. An en bloc resection is removing the entire implant and circumferentially the entire scar tissue of capsule. And as Dr. Stiles has mentioned, sometimes the bottom of that capsule is stuck to the chest wall. And in removing everything associated with the inflammatory response of that implant, you could create a worse problem. So you're then saying that you're not necessarily advocating en bloc resection of the entire capsule for explantation. Is that correct?
Well, what I will do for them is, it's a total or partial, almost total capsulectomy. I'll describe it as a 90% or 85% total capsulectomy if I can't get out all of that scar tissue. But a lot of it depends on what kind of capsule you find when you're in there, because these older patients with these older hard capsules tend to come out much easier and more in that little egg shape with the capsule inside than someone who has a grade 1 or grade 2 capsule that you have to peel away. And it does cause a lot of inflammation. The patients will have, I use drains post-operatively to help. And so what we talk about is, I don't know if this is going to take away your joint pain and your brain fog and your fatigue and all the other problems you're having. We'll just have to see how you feel after 6 months. Because I think that that's a good time frame to see what is actually making a difference for them. And it also gives us time to say, okay, are you someone who wants to have a lift? Or, if you're happy with the way your breasts look after that time frame. Because all of these cases cost the patients money, time off from work, time out of their lives, and so they're big decisions.
Darnah, do you feel amongst the discussion groups that you have that those people who feel they have breast implant illness should get the entire capsule removed, or is it simply the removal of the implant itself, or is there an absolute, or is it individually based?
This was a really difficult decision for me to make when I faced my surgery, going in not knowing, right? And it's something that a lot of women struggle with. It causes a lot of confusion and stress, just this decision alone. And I eventually came to my decision because I was talking to different surgeons, cosmetic surgeons, who said different things, and listening to all of these communities say different things. And so I phoned a friend who is a general surgeon who deals with a lot of cancer and breast surgery, but not in the cosmetic realm at all. And I asked him what his general medical opinion was, and he said he always removes the capsule, but not necessarily as an en bloc. And so that made my mind up for me, like, okay, I'm getting the capsule out. I think that there's a valid reason, a valid argument for getting the capsule out ultimately. But I totally agree with you, Dr. Stiles. It doesn't necessarily, there's no one size fits all on how that happens. And sometimes it is safer to leave some of it behind. And that comes down to trusting your surgeon's judgment. Mm-hmm. I don't, in the empowered explant community, I definitely don't push a one size fits all approach to surgery. I don't think that exists. And it's heavily frustrating to me, but there is a particular BII group that will, if you do anything other than an en bloc or even ask questions, they will block you from their community. And I was blocked. Several other women I know were blocked. And that I just think that that's a really shitty approach to pushing a one size fits all method. Shout out Nicole. What's up, girl? How you doing? But anyway, that's why I started Empowered Explant. Because I just think it's important that women get informed, right, about like the true information, and then make the best choice for themselves, because obviously, for all the reasons you said, Dr. Stiles, there are good reasons sometimes for having an en bloc. Sometimes a total capsulectomy is better, or a partial. But then there's also like the flip side to the coin, where I know women who can't afford that level of surgery, but they are really in pain or they're really unwell. And so they decide to just go for a simple explant and leave the capsule behind, which is significantly cheaper. Or they go and get local. I know a couple of women who went and they just got the cheapest surgery they could just to remove their implants, because they only had their implants for 6 to 12 months and they had a really adverse reaction to them. And they couldn't afford to spend much money on a whole nother surgery. So that's what they went and did. And it's not my place to tell them, hey, that's not the right way. It's up to them to choose what's best for them in that regard. And also, the most important thing is just to make sure you're working with a good surgeon.
As we get towards the end of our episode here, I want to ask you one or two more questions. I think it's clear that many plastic surgeons over the years have been somewhat invalidating about the feelings of breast implant illness by many of their patients. But on the other end of the spectrum, do you feel that there are some surgeons now who are exploiting for economic gain as being explantation experts and simply marketing a scared group of patients for the economic benefit rather than the medical benefit? I'll ask you first, Dr. Stiles.
Yes, I think that there are some people who do focus on being, they'll call themselves an explant expert, and there's no special training, there's no special certification that would make you an expert in this field. I also think that they pry on the fear of women having, not being able to get the en bloc resection, because some patients have come back to me and said, well, I've been to this other physician and he told me that he could 100% do an en bloc resection, and they won't have surgery with me unless I can promise that. But that's just not true. And I agree with your point, Darnah. When you're looking for a surgeon, you need to find someone who you feel comfortable with, you have full confidence in, and we'll have to put the plug for a board certified plastic surgeon in there. But those things are very, very important, because if you have a problem, if you have a complication, you need to know that you're with someone who's going to take care of you after the fact. There are some people who fly to different states to see the explant expert, and it's the same thing that could have been done by, a well-trained surgeon in their neighborhood. And unfortunately, yes, as in any field, there are people who take advantage of fear.
I would love to jump in here, because I am someone who traveled for my surgery to a surgeon who specializes in explant. When you said there's no special certification or training that makes someone an explant expert, I agree with that. However, I don't think that there is no such thing as training to make someone an expert. I think that becoming an expert in any field is about repetition, and it's about experience. And so for me, it was important that I went to a surgeon who was experienced in explant, who knew what they were doing in that regard. And also, the reason why so many women are going to these people is because we don't feel like we're going to be sold into a replacement or told that we're crazy. We know that we're going to someone who actually is taking us seriously. And that's been a big thing. And my mom explanted as well. And sitting in on all of her consultations, it was honestly outrageous, some of the things that I heard said to her from surgeons who were essentially playing both sides of the field. And there were some that were great, sure, but there were others that I'm like, oh, wow, you really want to put another set in her, don't you? Like, it was just push. And so she went with someone who just does explants for that reason alone. So I think there's a lot of reasons for that. And I also, are they capitalizing on this? I mean, maybe in some regard, yes, of course, it's business. I think that there are a shit ton of surgeons who are capitalizing on the fact that women have low self-esteem issues and want breast implants to begin with. I get half off sales on breast implants advertised to me. I mean, that's a thing that you see in cosmetic surgery as well. So I don't necessarily see it as a problem that they have gone in specializing in this area. I think that anyone can specialize in an area, and what that does is builds trust and confidence. Though I do agree with you that if somebody is selling you their dream, like, oh yeah, I can 100% promise you an en bloc regardless of situation, even if that's not the best case for the patient, or not even can't be promised, because when you're on the table, it could end up being something else, then yeah, like that's BS, right? That's a part of all that BS hype that they're selling. And so, yeah, I think whichever way you go, whether it's a surgeon that specializes or not, it's just about being heard, feeling confident in your surgeon, and knowing like what they can promise and what they really can't, and what is ridiculously overpriced and what is reasonable.
Yeah, and I think that that's a key point, because this is a cash-based procedure, and so if you can specialize in a variety of different procedures in plastic surgery. I think the problem from the plastic surgery community is when you use the word expert, that is telling your patients and your peers that for some reason you are much better at something than everybody else around you. And there's a difference. If you want to say I specialize in this, yes, that's one thing. But to truly be an expert, you need to either do a lot of investigation, publish a lot of articles, do something outside of just doing a lot of that procedure.
I mean, I would rather go to somebody who's done a lot of explant surgeries than someone that's published a lot of articles, but that's just me.
All right, as we get to our final question, Darnah,
Yes.
what is your advice to women who feel invalidated by physicians or others about their breast implant illness? What should they do?
That is a great question. There's a big part of trusting yourself in this process, and nobody knows your body better than you. So you know what you're putting in your body, you know your environment, you know if you're taking care of yourself on all the different levels. My advice is to research, get informed, and look at it all, but also don't go down the path of comparison, because that can be a really nasty trap as well. And go through that process of investigation with yourself. And I also want to just encourage these women who are thinking about this, and also share with both of you and the medical community and surgeons that this journey, having your breast implants removed, can be extremely empowering if handled correctly. And it can lead you down a path of making a lot of very powerful lifestyle changes that can support your health holistically, and also shift your mindset, shift those inner beliefs, improve self-esteem, and even without having perfect results, right? And that's the beauty of this, is coming back to yourself. So it's not for everybody. It may not be for you. But at some point you may have to face this. So just start doing the research, and before anything else, take that emotional journey. Figure out, go back to why you got implants to begin with. Do that difficult emotional healing work inside, and then come to that place of making the decision on what you want to do aesthetically.
Thank you. Dr. Stiles, what is your advice to patients who seem to be more motivated by fear, either generated from friends or social media, than their actual symptoms that they're having about removing their breast implants? What do you tell people to perhaps ease their mind?
Well, first of all, I hate when somebody comes in and they're so fearful and so anxious. So we'll go through what we know and what we know is related to the breast implants. We'll go through their symptoms. I think, a big part of working with the patients who are worried about having breast implant illness is you validate their symptoms. You look at all the testing that they've had. You look at, their ultrasounds, their mammograms, their MRIs, their thermography if they have it. And, you go through and you try to break it down to say, okay, these are some things that I think may be related and may improve if we take out your implants. these are some things that I don't know what is really going to happen. I think, and looking at the psychological journey, and going back to why they had implants and how, because a lot of times they're afraid of what they're going to look like without implants because they've had them for so many years and it becomes part of their identity. And I find that the women who are happiest after having an explant are the ones who had some dissatisfaction with the implants to begin with. I mean, for example, they wanted to be a C, they wound up a double D. They, never liked them. They got the implants for somebody else or some other reason, or there was something else going on. And, I think we can do a really good job assuring them that if they have a capsular contracture, if they have breast pain, they're going to feel a lot better after we take them out. And that this is, something that we're going to work on over the next 6 months to a year to, your lifetime, as far as how you feel after the implants come out at 6 months, a year, 5 years, 10 years. Because we can't make guarantees, but I don't want them to go into the surgery just because they're afraid that may be the cause. And if they have to get to a point where they're realistic about, well, you know what, if these implants come out and I feel great. If these implants come out and I don't feel great, I've checked that box off and I'm going to figure out what it is that's causing the problems that I'm having. And so it's that ongoing investigation to figure out what it is that is going to make them feel better and live life better.
In your practice, can you estimate a percentage of women who have breast augmentation that come back and complain about breast implant illness?
For implants that I've placed?
Yep.
I have 2 patients who I've done the primary augmentation in. Actually, 3 patients who I've done the initial augmentation in who have come back and have had problems, had the implants taken out.
That's a small percentage of your total practice.
Yes, but I've taken care of a lot of women who have had implants done elsewhere throughout their lives who have come and taken their implants out. And I mean, to be honest, in the past 2 years, I've probably done more explants than I've done primary augmentations.
Okay.
So, and I would say it's really interesting because one thing that's been very apparent to me is that women tend to not go back to the surgeon that did their implants for their explant or to rectify an issue. And that's just something that I've noticed. I know that I didn't even call my surgeon about my concerns. So that's pretty common.
Final question.
Go ahead. Well, just one thing I was going to say, though, honestly, there are some surgeons, and this goes back to your comment, Dr. Grossman, about validation. There's what I find a lot of times women do go back to their original surgeon, and their original surgeon will tell them there's nothing wrong with your implants. It's not going to make a difference. And then they'll come to see me or they'll go to see someone else. But I mean, I would hope that if one of my patients from 15 years ago had a problem that they would, and they do, that they would find me and trust me to help them at that stage. Because the flip side is usually if somebody goes somewhere else for an augmentation or for an explant, we'll get a request for medical records that we have to send. So we usually at least know that something like that is going on.
Okay. Final question.
Sorry.
Yes or no? Darnah, if a healthy young woman wanted breast implants, would you encourage her or discourage her?
Discourage.
Christine, would you encourage or discourage a young healthy woman who wanted breast implants?
I would have to say I would encourage her to have implants.
Kind of thought that was going to be the answer from both of you. And the controversy, and perhaps the alliance, I think continues with both of us. I think this is an evolving topic. We all have to become more educated, and I think I have become more educated, Darnah, because of things that I've seen you say, and I think getting a better appreciation of our patients. I still have a belief that breast implant surgery can be an excellent surgery, but it is far from a perfect surgery, and I think all of our patients need to know that. And with that, I want to thank you both very much for joining us. Darnah Mercieca and Christine Stiles, thank you so much for being with us on Beauty and the BS.
Thank you so much.
My pleasure to have you guys. I would like to take I would like to take some time to thank our friends at True Niagen, who supplied myself and our staff and our production crew with True Niagen, which is an NAD plus supplement, with good for brain health, aging, lots of other stuff, and we appreciate sending that to all of us. We hope you join us on the next episode of Beauty and the BS. We'll see you next time. Thanks so much. The Beauty and the BS podcast executive producer is me, Dr. Peter Grossman. Our producers are Max Banta and John Largent, and editing and post-production services are provided by Game Day Media. You can listen to Beauty and the BS wherever you listen to your favorite podcast. And if you would like to leave a comment or ask me a question, go to beautyandthebspodcast.com and click on the microphone icon, and we may use your comment on a future episode. You can also find our archives, video clips, and more on the website as well. Thanks for listening to Beauty and the BS with Dr. Peter Grossman.